afternoon, everyone, and welcome to our three-part series on the report of the Healthy Kids panel, entitled No Time to Wait, the Healthy Kids Strategy. I'm Lorna McHugh, Executive Director of the Ontario Healthy Communities Coalition, which is a member of HC Link, and I'll be your moderator today. Childhood obesity is at a crisis point in Canada. Almost 1 in 3 children in Ontario are now at an unhealthy weight. Children who are overweight or obese are likely to struggle with their weight throughout their lives. As they age, they're more likely to experience chronic health conditions such as type 2 diabetes, high blood pressure, heart disease, and arthritis. Many of the severe physical problems associated with being overweight or obese as a child may not appear until adulthood, but the social and emotional problems that often accompany child obesity start early. Overweight and obesity also threaten the sustainability of our healthcare system. In 2009, it was estimated that obesity cost Ontario $4.5 billion. In January 2012, the Ontario government set an ambitious target to reduce childhood obesity by 20% in 5 years. To help figure out the best way to do this, they convened the Healthy Kids panel. 18 members were selected to be on the panel from different sectors and walks of life so that they would bring diverse perspectives to the table. The Healthy Kids panel conducted extensive research and consultations before developing a comprehensive three-pronged strategy to address the complex issues of child obesity. Members of HC Link see this as a very important and timely report, so we organized 3 webinars to raise awareness of the report and to share information about some of the current initiatives that are helping to implement its recommendations. Each of the webinars focus on one of the 3 prongs of the Healthy Kids strategy. The first prong of the strategy is to start all kids on the path to health. Laying the foundation for a lifetime of good health begins even before babies are conceived. The second prong is to change the food environment. Parents know about the importance of good nutrition, but while trying to provide healthy food at home, many feel undermined by the food environment around them. They want changes that will make healthy choices easier. The third prong, which we're going to discuss today, is to create healthy communities. Kids live, play, and learn in their communities. The panel recommends a coordinated, all-of-society approach to create healthy communities and reduce or eliminate the broader social and health disparities that affect children's health and weight. The Healthy Kids panel reported that parents want help encouraging their kids to be more active and engaged in their communities. The food strategies the panel recommended, which we talked about at the last webinar, will be most effective when they're integrated with broader, community-driven efforts to raise healthy kids. Just as kids need access to healthy foods, they need opportunities to play, spend time with friends and family, and to learn how to manage stress. This prong of the Healthy Kids strategy also focuses on the support and treatment needs of children and youth struggling with unhealthy weights, and on the mental health and resilience required for kids to be healthy. The panel also pointed out that as much as possible, we must build on or leverage existing programs, services, and providers. Creating community environments that support healthy and active children is a complex matter, and the panel carefully considered a number of areas, such as the need for social change. During their consultations, parents pointed out that our problems with food are part of a larger social trend, a time-stressed culture that, in just a couple of generations, has completely changed eating habits and activity levels. We're coping with unprecedented technological advances. Many people worry about financial stability. They feel rushed, tired, socially disconnected, and are experiencing high rates of mental health problems. To help parents raise healthy kids, we need supportive communities that promote and protect health and help families find balance in their lives. The potential of a community development approach was promoted by the panel. There's already a number of health, education, and recreation programs that promote physical activity and healthy eating. Some have been very effective, but this patchwork approach hasn't had the same measurable impact as a more coordinated, community-driven initiatives in other jurisdictions. For example, EPOD, Ensemble Prévenons l'Obésité des Enfants. That's Together Let's Prevent Childhood Obesity. This program was developed in France in 1992 and is now in use in 15 countries, and it has a highly successful track record. The original French communities saw the proportion of overweight and obese children drop from 12% to 8.8%. Some communities in Europe have seen a remarkable 22% decrease in childhood obesity and overweight, while the proportion of overweight children in control towns increased by 17%. The role of schools in child care settings is also an important consideration. The panel looked at school food and beverage policies, examined the results of the daily physical activity guidelines, and considered play-based learning. And we're going to hear more from Drew and Margaret about healthy schools. They looked at the importance of role models and champions. They emphasized the importance of positive role models and expect that professionals who teach and care for children will take on these roles. They also considered the potential to leverage other strategies. The Healthy Kids strategy is not the only strategy trying to influence child health. Some have similar health messages, and others, such as transportation strategies and municipal plans, can have a direct effect on how active kids are and how easy it is for families to raise healthy kids. Ontario also has comprehensive strategies that are working upstream to address the underlying causes of unhealthy weight, such as the poverty reduction strategy and the mental health and addiction strategy. And finally, they looked at access to timely support and treatment services. Ontario currently has a small network of pediatric weight management programs, but there are more children who could benefit from these services. So following these considerations, they came up with 8 recommendations. To develop a comprehensive Healthy Kids social marketing program that focuses on healthy eating, active living, including active transportation, mental health, and adequate sleep. To join EPODE International and adopt a coordinated community-driven approach to developing healthy communities for kids. To make schools hubs for child health and community engagement. To create healthy environments for preschool children. Develop the knowledge and skills of key professionals. To support parents in raising healthy kids. To speed the implementation of the poverty reduction strategy. To continue to implement the mental health and addiction strategy, and to ensure families have timely access to specialized obesity programs when needed. So now I'm pleased to turn the webinar over to our panel presenters who will be building initiatives. On the call today, I'd like to welcome Drew McGinn, who's the Division Manager of Healthy Schools and Communities at OFIA, Margaret Good, a Healthy Schools and Communities Consultant at OFIA, Tamer Meyer is a Health Promotion Consultant at the Health Promotion Resource Center at the Center for Addictions and Mental Health, and Kayla Lee is the coordinator of the Fuel Program at 9th Region Public Health. As I mentioned before, we're going to hold questions until the end of the webinar, and we will make sure that we have time for questions at that time. But please, in the meantime, put your questions in the chat box, and we can be ready to answer them at the end of the session. So Drew and Margaret, would you like to tell us about OFIA's Healthy School Communities?
Definitely. Thank you very much. Just wanted to say good morning to everybody on the line. As mentioned, my name is Drew McGinn. I'm a division manager at OFIA, working in our Healthy Schools and Communities division, which focuses on any of our projects or initiatives relating to community engagement, specifically around the Healthy Schools approach. I'm also joined by Margaret Good, who is our Healthy Schools and Communities consultant, who has been doing work in communities across Ontario for a number of years for us on a number of different initiatives that we'll speak to today. So for those who aren't aware of what we do at OFIA, our goals are pretty simple. It's really to help kids develop the necessary skills to make healthy choices by creating school communities that promote healthy, active living. Our main deliverable in doing this is we develop and support delivery of quality school-based health and physical activity programs and services within a comprehensive school health framework. So over the past 10 to 15 years, we have learned a lot about creating healthy schools and communities through a lot of extensive collaboration with partners, with school boards, health units, and really other stakeholders at the provincial, regional, and local levels. So today the focus of our presentation presentation is really going to be providing a brief overview just on the Healthy Schools approach and the Comprehensive School Health Framework. We're going to chat a little bit about some initiatives that we have worked on over the years, some key learnings from each of those initiatives that's really helped frame how we approach healthy schools and community engagement. And lastly, we're just going to talk about a few tips, tools, resources that we have available, as well as some programs that we're working on in the coming months, just to give you awareness of the types of work that we're doing towards healthy schools. So what I'll do right now is I'll turn things over to Margaret, who will get us started on the Healthy Schools approach and some background.
Welcome, everyone. It's great to be part of this panel, and as Lorna mentioned, the No Time to Wait panel emphasized the importance of role models and champions, and in looking at the participant list today, I recognize a lot of amazing role models and champions that are advancing healthy schools throughout the province, so it really is a pleasure to be speaking with you today. So why healthy schools and communities? Why this approach? Well, the Healthy Kids Strategy Recommendation 3.3 did say make school hubs for child health and community engagement, create school communities where nutrition, physical education, and health are more than part of the curriculum. They're an integral part of every school day, and we certainly agree with that. Schools are the ideal place for community organizations to connect with students and families from all backgrounds. We know that 95% of Ontario children and youth attend public schools, and really experts agree that schools are the ideal place to promote physical activity for children and other healthy behaviors as well. Kids spend an average of 6 hours a day, 5 days a week for 12 to 14 years in school. And that's with kids beginning in at age 4. Also, according to the Pan-Canadian Joint Consortium for School Health, health and education are interdependent. Healthy schools are better learners, and better educated individuals are healthier. Research has shown that the comprehensive school health, or what we refer to as the Healthy Schools approach, is an effective way to tap into that linkage, improving both health and educational outcomes and encouraging healthy behaviors that last a lifetime. In the broader school community, it helps students develop the skills they need to be physically and emotionally healthy for life. So I know many of you are very familiar with the basics around healthy schools, so just think about what comes to mind when you think of the term healthy schools. It's sometimes a difficult concept to explain to people who aren't familiar with the Healthy Schools concept. So OFIA developed an illustrated video called Healthy Schools, Healthy Communities, How You Can Make a Difference. It's about 6 minutes long, and we found it to be a very useful tool to use with people of all ages. It's designed to support individuals and communities in working together to create healthier school communities. In Ontario, I'm sure, again, this Foundations for Healthy School framework is probably familiar to many. Comprehensive school health approaches are known by a variety of names. We started with the words living school back in 2003, but comprehensive school health is another way of speaking to it. Health promoting schools, coordinated or comprehensive school health programs, quality school health, healthy active living school communities. There are a variety of names. But the term healthy schools has been used within Ontario primarily since 2006, when the provincial government released the Foundations for a Healthy School. And that framework provides an integrated whole school approach to address a wide range of health-related topics in a planned and integrated way. And as you're probably aware, there are 4 components: high-quality instruction and programs, which refers to the curriculum, teaching, and learning. We also have the physical environment, of course, that includes the school premises and surroundings, so the buildings and grounds, materials and equipment used in school programs, routes to and from school. Supportive social environment is really all about building positive relationships within the school community and creating a safe and healthy school environment. Partnerships involve, of course, not only the staff within the school and the students, but families and a variety of community partnerships. The Ministry of Education is hoping to release a revised Foundations for Healthy Schools in the fall, and many of you I know have seen that revised version, which has been released in draft. The new version is similar to the original Foundations for Healthy School, but it aligns with the indicators for the school effectiveness framework that all schools in Ontario implement. There are now 5 components. The first one is curriculum, teaching, and learning. And the second one is school and classroom leadership, student engagement, social and physical environment, and homeschool and community partnerships. So we really do look forward to seeing the release of this foundations. I'm sure it's going to resonate well with schools because it does align with the school effectiveness framework and is very comprehensive. You'll find details about these resources and a lot of other information about healthy schools and achieving excellence, which is the renewed vision for education in Ontario, on the Ministry of Education's website in their Healthy Schools section. So I'd like to speak a bit about a healthy schools process. We all know that, of course, each school community is unique. While they all have different priorities and desired outcomes, school communities are encouraged to establish a process to address the health-related topics in a comprehensive manner. We found with our work with OFIA and our various partners that the diverse communities that we've supported have all used the same process, but resulted in very different outcomes. The Healthy Schools approach engages school communities in addressing topics such as physical activity, healthy eating, tobacco prevention, mental health, and a variety of other health-related topics that are important to schools. The first step is, and this isn't really in a chronological order, however, we do need to consult the school community, and it often takes a champion to get that started, but we want the whole school community engaged to work together to create a shared vision. So that would include, again, the school staff, students, parents, community partners such as public health, other school boards and schools, recreation and sport groups. It could be police, fire, the municipalities, universities and colleges, local businesses, the media, not-for-profit organizations, whatever makes sense for that local school, who's available in the community to share their assets. And we do have information on our website to support this stage of the process. You need to establish a school-level team. Again, you need a champion, and it just need to build understanding and commitment of the Healthy Schools approach. Then create a plan, and again, so important to involve students in this. We really need them engaged meaningfully so that this is something that resonates with them and that they can help to advance in their school. And then, of course, implement that plan and monitor it, and evaluate and celebrate accomplishments along the way. I'm going to talk a bit about some of our initiatives that have been taking place since actually 2003 when Living School was first introduced. And I know, again, some of the people who are on the phone today or on the webinar participated in that. Also, Lungs Are for Life, Partnership for Healthy Kids, Smoke-Free Ontario pilot program. And all of these programs clearly demonstrate that this approach affects changes in attitudes, a change in the culture of the school community, and it fosters a feeling of success from all the partners that are involved. Utilizing a consistent approach to school and community engagement, in other words, the Healthy Schools approach, these initiatives address multiple risk factor areas, including physical activity, healthy eating, and other health topics. So Living School was a groundbreaking initiative that brought together entire communities. And I would say it started with the school board and public health and teachers participating, but quickly expanded to involve sport and recreation organizations, community coalitions, and local businesses were very important as well, and municipal governments. And they all work together to enhance active and support active, healthy living for kids. There were 9 living schools in the first year, and we expanded to 34 over the next 3 years. It was school-based, and we did find some very important key learnings that have helped to expand and enhance the Healthy Schools approach throughout the province. So the research supports the following findings that were observed in all school communities. There was a growing appreciation of the value of community partners and how to work effectively with them. There was a growing belief in the ability of the school community to influence student health behaviors and attitudes. And certainly in some of these communities, public health had already been a partner and recognized as being very valuable. But in some of those schools, it was the first time they had really reached out to community partners at all. There was an increased sense of belonging, attachment, and safety in the school community. Even after the first year, there were increased physical activity levels and healthy eating behaviors among both students and teachers. There was increased reported increased student attentiveness and alertness, increased student attendance, and a reduction in behavioral issues. There were also significant improvements in the EQAO, the Educational Quality and Accountability Office test scores. And this was, this study examined the effect of the comprehensive school health model on academic achievement and showed evidence of significant improvement in the test scores in grade 3 and 6 after year 1 and 2 years of exposure, suggesting academic benefits to the Healthy Schools approach. We do have a Living School Success Story booklet that's available on our website, and you'll find lots of stories that are very inspiring. You know, for example, in New Lowell, a very rural school, partnered with their fire department, and the firefighters offered to keep the local school rink flooded during winter. The school also sold good food boxes with locally grown food at the school. Shandy Bay Public School partnered with Public Health and the local Lions Club. The Lionesses came to the school and worked with the students to make healthy muffins. J.R. Henderson Public School in Kingston worked with their community partners to transform their schoolyard and create an active play area for kids of all ages. And to promote student ownership, each class submitted their vision of the new schoolyard, and then the new space was designed based on input from the students, staff, parents, and with the help of a local parent who is an architect, the new schoolyard design featured trees, gardens, a stone amphitheater with a gazebo. And the final design included a fitness trail with activity stations, mini putt, new basketball and volleyball courts. It was a huge community effort that did include fundraising, of course. You can find more about this initiative on our website. The next one Drew's going to speak to, our Lungs Are for Life initiative.
So just to dovetail off Margaret's point, after Living School, we were running the program Lungs Are for Life. So it was a program that we were managing that was owned by the Ontario Lung Association. Lungs Are for Life was a series of basically curriculum lesson plans that were implemented in schools, everywhere from kindergarten all the way up to high school. So as part of that funding, what we did in 2008-2009 was we wanted to really take this program to the next level and start to implement it within the context of a healthy school. So during the 08-09 school year, we worked with elementary schools, so focusing on the middle school age students, so grades 7 and 8. We implemented this approach in 10 schools. So using the Lungs Are for Life lesson plans as that high-quality programs and instruction, we went into each of these schools and we started implementing the Healthy Schools process with them to talk to them about, with kind of the programmatic component of that, fulfilling that quality program and instruction, what type of activities could they do in the other 3 pillars of the Healthy Schools framework to be able to make some impact in terms of tobacco prevention at the school. So in doing that work, we did work with the University of Waterloo to do an evaluation as well. Based just on the timing of the school year, we were actually only able to be in schools for about 6 months, so from January of 2009 until June of 2009. So from that program, we actually had a couple of very interesting key learnings. The first was that we did actually see some student-level change within the 6-month time period. So understanding that behavioral change does take evaluation over a long period of time, we were actually quite shocked to see that within these schools we saw some changes in terms of really kind of student attitudes, perceptions, their understanding of tobacco prevention within a really relatively short period of time. What we also found was that we went into the schools to have these conversations. They wanted to not only address tobacco, but other topic areas that they felt also impacted tobacco as well. For example, in one of the schools we worked with, they really kind of focused on the idea that a lot of the reasons why they found students in the schools were smoking or using tobacco was that they didn't have anything to do after school. So one of the schools addressed that by offering a gym. So they worked with a local recreation provider, and they set up a gym on their school stage that would be running anytime from 4 to 6 after school, just as a means of finding how tobacco could be impacted by not necessarily a tobacco-focused activity, but something they felt would impact just students' decision to use tobacco products. We started to really see that impact of student engagement. We started to see it in Living School. We saw it in Lungs Are for Life as well. So really the students directing the activities that were happening and really taking that ownership. The regional context was huge. So obviously with tobacco being at times a topic that can be a bit challenging and can be something that can seem very aggressive towards people who are using tobacco. So kind of learning about the language and not calling somebody a smoker and understanding a bit more around the context of why they might be using that product. As well as school board and public health engagement. So for this project, we did have very significant contributions from the local health units and really just started to see the incredible value of seeing those connections and seeing really the support that was able to be provided to those schools around tobacco prevention. So I'll speak to Smoke Free Ontario, which is another tobacco project we're doing well, but Lungs Are for Life was really kind of the first step for us in getting a better understanding around how tobacco can be addressed through this comprehensive framework. So I'll flip it back to Margaret to talk about Partnership for Healthy Kids.
So through Living School and Lungs Are for Life, we did learn that this approach works well at the school level, but we also knew that for sustainability, you need buy-in and support at the systems level. So with this in mind, 5 provincial not-for-profit organizations involved in health and education and recreation for kids came together in 2011 to form the Partnership for Healthy Kids with the goal of working in collaboration in communities across Ontario. So the provincial partners were Health Nexus, OFIA, People for Education, Parks and Recreation Ontario. And there were initially 5 partners, but OPHA left the partnership following organizational restructuring in year 2 of the project. So over the past 4 years, these provincial organizations worked together to support very diverse partnerships in 7 communities across Ontario, including Halton, Hamilton, Hastings and Prince Edward counties, North Bay for the French community, and Ottawa, Thunder Bay, and Windsor, Essex. Each community partnership was very different, unique, combined of a mix of stakeholders from education, public health, recreation, and others, all working towards strategic goals set by the community. March 31st, 2014 was the end of the 4th and final year of Partnership for Healthy Kids, and the evaluation report, final report, will be available soon on the Partnership for Healthy Kids website. Now, our key learnings included valuing and nurturing partnerships. It's all about those relationships, and not only with individuals, but with the organization, so that when individuals leave, the relationships do not end. Get partners there at the beginning whenever possible. That might be the beginning of the partnership or the beginning of the school year. Just bring them in. Community consultations should include anyone who would be affected or impacted by the work of the partnership. So again, the ones that we spoke to earlier. One example was in Thunder Bay, where the partnership included the fire chief, police chief, municipal government, Aboriginal leaders, public health, recreation, the university, parents, and they all contributed their unique services and resources, assets, if you will. It's that process of getting everyone around the table that's probably more important than the actual activities that take place. In Hamilton, during the very first community consultation, a recreation leader and a school vice principal got together, and based on that conversation, a new program was created called Skate the Dream. And 4 years later, it's still running, has expanded. It provides kids who don't normally have access to equipment and so on to be able to play hockey, to learn to skate. It's a very successful program. Stages of group development are normal. Messy is good. It's part of that process. But it is important to work together to understand the various partners and where they're coming from and how they could fit. Even the term healthy schools sometimes is a bit intimidating to someone perhaps from recreation who isn't familiar with it or how they might fit, but they all have assets that could be shared. Buy-in at the provincial level was important as well, so we all supported each other and learned from each other, and we did provide some training on, for example, parent engagement. Health Nexus supported communities in addressing social determinants of health. We also recognized, and the communities recognized, the value of an external facilitator. So for the community consultation, it was OFIA, and in the continuing through the years, our various partners supported that. But keep in mind that all of the certainly public health units and other partners can act as an external facilitator, but it is really valuable to be able to participate in that in the conversations as well. Important to create a common understanding of the different sectors. So you can learn more about this on Partnership for Healthy Kids, p4hk.ca. And there are different stories from each of the communities that participated. As a result of what we learned through the Partnership for Healthy Kids, the partners, provincial partners, created the video, Healthy Schools, Healthy Communities, How You Can Make a Difference. And OFIA has also developed infographic posters and tip sheets that delve deeper into the sector-specific partnerships. And our hope is that these tools will offer a stronger understanding of the benefits of collaborating with various sectors and community partners, and will provide the knowledge and the how-to that will support them in creating strong partnerships. I'm going to turn it over to Drew now.
So the last program we're going to talk about is Smoke Free Ontario. So Smoke Free Ontario is a pilot program that we're actually right in the middle of implementing. It's a program running over the course of 2 school years, so the 13-14 school year as well as the 14-15 school year. What makes this a little bit unique in terms of this approach is that we are running the intervention at the school level, so elementary and secondary, focusing mostly on secondary schools. 2/3 of the schools are secondary schools. Really with kind of focusing on, as Margaret kind of quickly alluded to, some of the small revisions in the Foundations for Healthy School framework, really focusing on 2 kind of major components at this point. So one component really being that idea of authentic student leadership opportunities at the secondary and senior elementary level, but also really this idea around how do you train adults to be allies versus really driving the activities that are happening in schools. So as I mentioned, we have just finished the first year of the program. So what I'm going to share is just some key learnings that we've had through our first year and that we're actually going to apply to the second year of implementation. So within this program, we do also have quite a robust evaluation component. So we are working with Queen's University, the Social Program Evaluation Group, who you might know is implementing the Health Behaviors in School-Age Children Survey. And also on our advisory committee, we do have members from the University of Waterloo as well, just providing some expertise around our data collection, our analysis of data, and how we can really understand whether we had an impact at the schools. So the first piece I'll speak to is really this idea of authentic student leadership opportunities. So once we had identified the schools we would be working with, we started working quite closely with the Youth Advocacy Training Institute operating out of the Ontario Lung Association. The goal of that was when we first went to work with these schools, after we had identified not only a key school contact, but also a key public health contact from the local health unit, the first focus was around really training around what we mean by youth-led opportunities. So YADI went in, they provided that training not only to the adult allies, but also to the students in the school. One piece that they focus on that's been quite interesting in terms of the project is really how do you motivate youth around a topic like tobacco, and how do you get them really motivated to want to do something. So the big focus of this project really is around the idea of tobacco industry denormalization. So taking that onus off of the individual person who might be using a tobacco product and really focusing on the industry and really that manipulation, how the youth are being manipulated into using the product without even knowing at times that they might be using it. Once we'd actually done that initial training, then we went into the process that Margaret had spoken to earlier. So we sat down with a number of different members of the school, the local public health unit, contacts from the school, school principals, as well as a number of youth at the school to develop an action plan. The one piece that was a little bit unique about this was that the students were very much in control of the action plan. So in terms of there was no right or wrong idea in terms of what activity to do. It really was focusing on what do the students want to do and what do they think will have an impact with their peers. The piece that was a bit interesting as well was that community context. So out of this year, we have worked with a number of these schools who have started again to bring up that same finding that we found in Lungs Are for Life is that they've done a lot of really great work within tobacco prevention. They're now looking at potentially opening them that as well to other topic areas too. So understanding that schools are very busy places. They want to be as effective and cover as many of the health topics as possible. This year, while still focusing on tobacco prevention, we are going to provide some opportunities for them to open up their work to move into other health topic areas as well, too, to really expand this work that's happening. The school board support has been a really key piece as well, and I'm going to include public health as well in that. So before the project even started, understanding, and any of you who've done anything that has to do with evaluation and ethics approvals and all those sort of pieces understand it can be a very time-consuming process. So before approaching any of the school boards for ethics approval, we did speak to local health units that were serving schools in that board. We also spoke to key contacts at the school board to really get their support before we submitted any sort of ethics approval. Recognizing that school boards can receive anywhere from 5 to 10 to 50 applications a year of evaluation work that's happening in the school. We really wanted to make sure that what we were doing was aligned, that school boards were interested, and that it did align with their priorities as well. So just taking that approach, different boards have very different ethics processes, but we were approaching boards who were interested in the project and did see it as a value to their school. The last piece was that integration of multiple health topic areas. So as I mentioned before, not only have we expanded the health topic areas, but even within tobacco prevention, in terms of the programmatic offerings, so again, the curriculum lesson plans that we're offering with this project, we've actually moved outside of just health and physical education. So for the most part, in the past, we had provided lesson plans that were very focused around health and physical education as kind of that curriculum piece. What we've actually done in this project is offered lesson plans across a number of different topic areas. So you will see opportunities for teachers to address tobacco prevention in class in the health and phys ed curriculum. Understanding there is only one mandatory health and phys ed curriculum in secondary, we did really want to expand that message across a number of other topic areas as well too. So you'll see it pop up in history, in law, in media, in art, in drama. So just really making sure that students who might be impacted by tobacco or other health topic areas that could be a concern to them are able to get that information in class, sometimes not in the class that they're expecting to receive it in as well. We're all kind of aware that the just say no approach is a little bit outdated at this point, so really focusing on that idea of students making healthy choices for themselves and understanding why they're making choices as they're being bombarded with a lot of information around tobacco products, and as any of you working in tobacco prevention are aware, a number of new products as well that they might be unfamiliar with, like e-cigarettes, that they might not be as comfortable with as well. As I mentioned, we're in the middle of implementing this project. If you go to our website, ophianet.com/smokefree, we do post quarterly updates on the project just to keep people aware of where we're at, and any resources that we're able to share more broadly. So an example of that is if you go to that section of the website, we do have an Ideas for Action guide. So working with a number of health units across the province, what they've done is provided activity ideas that students could implement in schools. So within that context, it's really giving them the opportunity to be able to implement any sort of activity that they find to be easy, of interest to them, and it just gives them the sense of that as well. So just to close about how we can help, as I mentioned, on our Healthy Schools website, we do have a number of tools, resources, and information available to you. As Margaret mentioned, we are currently just putting up our Understanding Partners poster series, which provides general information around just partnership opportunities with schools, public health, recreation, and parents, and a bit more information about some of the priorities of each of those different sectors. The other piece is that we have started at the initial phases of developing a Healthy Schools accreditation program. So as I mentioned, we're in the very, very early stages of that. So if you do go to the website, you'll notice there's a tab on the left-hand side that says AFIA's Provincial Healthy Schools Initiative. You can find out a bit more information about that. We do have a specific newsletter that we do send out to interested parties around that specific initiative that we're working on, so I'd encourage you to sign up for that as well. So with that, just want to say thank you very much for allowing us both to present, and we look forward to your questions at the end of the presentations.
Well, thanks, Stu and Margaret. That's an amazing amount of work that you've... There is one quick question here that I can answer. You had referred to a report that was going to be released, and I was wondering if somebody has wondered when it will be released. Do you know which report they're referring to?
Yes, for the Partnership for Healthy Kids. We're currently just wrapping up all the data from that, so we do have the report and an executive summary that we're going through. So I would anticipate we'd have it ready within the next month or two to be released.
And how would people access it?
They would go to the website, so p4hk.ca.
Great. Okay, thanks very much. And now it's Tamer's turn. Tamer, would you like to tell us about the Mental Health and Healthy Kids initiatives that you're working on?
I would love to, Lorna.
Great.
But good morning, everyone, and I'd really like to thank you, Lorna, on behalf of HC Link for the opportunity to participate today and to talk a little bit about the work that we're doing at the CAMH Health Promotion Resource Center. And so you can see from the title of this slide, I'm going to spend some time today to highlight some of the results from the Connecting the Dots report, and I'll go a little bit more information about that report in particular. But what I'm really going to look at in the report is to highlight how public health units are addressing both mental health and healthy weights. So just a little bit about the Resource Center that I work at. So again, my name is Tamar, and I'm the acting manager with the CAMH Health Promotion Resource Center. And this resource center is situated within CAMH's Provincial System Support Program, and our team is based within the Knowledge Exchange team. So we're funded by the Health Promotion Division of the Ministry of Health and Long-Term Care, along with 13 other health promotion resource centers. So there's 3 in total at CAMH. There's TEACH, OTRU, and then us. And our main focus in terms of the CAMH Health Promotion Resource Center is primarily on mental health promotion, mental illness prevention, and substance misuse. But again, we often partner with colleagues and other health promotion resource centers like PARC at OFIA, the Nutrition Resource Center, to make sure that when we're looking at topics like healthy eating and physical activity, that we're taking a holistic approach to making sure that we're addressing both the mental and physical health of populations. So we consult with our colleagues across the organization. So as you may have seen, we've done a number of webinars highlighting the OSTIS results, and you can look forward to the upcoming mental health and well-being results in September, which will actually highlight both the mental health and well-being of Ontario students, but also some information around the physical health in terms of sedentary behavior, obesity, self-reported health. And so I want to highlight that as a great, that OSTIS report is a great resource, and you can find some more information about that on HC Link and also on the Evidence Exchange Network. So I'd like to actually, before I get into highlighting what the Connecting the Dots report is, just, Helen, would you mind pulling up that poll question? I'd just like to ask the participants on the line, so I see we have about 60 people on the line. I just want to ask you, have you heard of the Connecting the Dots report? So we've got 3 options there. Are you familiar? You've heard of it? No, I haven't heard of it. I just want to get a sense of who has heard of it online. I recognize some of you are sharing phones. So I see the majority of you have not heard of the report, which is great, because then, we're continuing to be able to share this information via this webinar, but I do see that just over 20 of you, or close to 50%. So thank you very much for that. So Helena, if you wouldn't mind just popping back to the original slide. So again, as I mentioned, what I'm going to be doing is sharing the highlights from this recent report. So this was a project that we completed in partnership with Public Health Ontario and Toronto Public Health called Connecting the Dots. And I'm going to really focus on pulling out, sort of as a secondary analysis, those activities and initiatives that we found that addressed both mental health and healthy weights. So this report was a study, and we went through ethics and went through all the research protocols and did a review. So it consisted of an online survey and a series of key informant interviews. And so participants in this survey included included employees from Ontario Public Health units who had experience or were working in or overseeing mental health activities and initiatives. So this survey in particular was designed to identify activities that were conducted by Ontario Public Health units to address the mental health of children and youth between the ages of 0 to 19. And the key informant interviews were designed to provide insight into the strengths and challenges that health units are currently experiencing when addressing the mental health of children and youth, as well as to identify opportunities for support. So the purpose of the survey and of our project was really to focus to capture on the range of child youth mental health activities, initiatives, services, and programming currently happening across Ontario's public health units. So as you all may be aware, mental health is increasingly being considered as a key component of overall health and well-being, and we can see it, really clearly embedded within strategies and initiatives, including the Healthy Kids Panel report, and a number of different funding streams. However, in public health, the role of public health and mental health has not been well described. It's embedded within the Ontario Public Health Standards, which, as you know, guides the work of public health units. But the Ontario Public Health Standards, it lacks an explicit mandate to address mental health. But we do know that mental health is embedded throughout. However, we know that health units are required to respond to local health needs, which often include mental health concerns. So the purpose is outlined above again, and the research also invited thoughts and barriers of public health units about child-youth mental health. So when we look at the scope for this project, the research team opted to include a range of activities to promote and or address mental health across public health units, from mental health promotion to mental illness prevention to mental health and mental illness activities, including policy development, committee involvement, development of service or work plans, and also partnerships with local mental health organizations. So we really wanted to capture the full range of activities that were happening across Ontario's 36 public health units. So all activities did need a mental health focus. So you can see here on the left-hand side, those were some of the terms that we asked our partners it needed to be explicitly mentioned in one of 6 areas, any of these terms. So it could be bullying, violence, discrimination, mental well-being, mental wellness, and it needed to be articulated explicitly in the description, the goal or objectives, the outcome, the service plan or work plan, a logic model, or indicators. And this was on children and youth. Chose to have this focus. I think it fits really nicely. First of all, the first phase of the 10-year mental health and addiction strategy focused on children and youth, and we do know that children and youth is a huge priority in terms of public health activity for both Ontario Public Health Units and also the Ministry of Health and Long-Term Care. So I'm just going to provide, again, a really, really high-level overview of the findings, but if you'd like a little bit more detail, we have done a number of webinars providing a more in-depth analysis and overview of the results, and this information can be found on HC Link, and we have a report and a number of summary documents, and I can actually put those web links in the chat pod once I'm done my presentation. So we had all 36 Ontario Public Health Units complete the survey, which was fantastic. And what you can see from this slide are just a high-level overview of the findings. So our findings found 325 activities or initiatives reported. And so that ranged anywhere from 1 to 32 activities per health unit. And we found that many factors shape and influence the role of public health units, both individually and collectively. Some of these are supportive in nature while others present barriers. So some of the barriers was that there was, again, not an explicit mandate for mental health, that there was a greater need for system-level coordination, the role of stigma in addressing mental health, but there were some key enablers. Partnerships were seen as a great enabler for actually doing activities related to child and youth mental health, a good alignment of evidence. Leadership was identified as a key enabler in terms of the ability of public health units to address child and youth mental health, both at a staff level, at a leadership level in terms of associate or chief, medical officer of health, and then also having an integration with mental health at a public health unit level. So our research did not specifically ask about the integration of mental health and healthy weights programming or other programming for that matter. But however, the process of intertwining mental health with other public health activities and goals was a very strong theme in our qualitative interviews. And you can see a couple of quotes here that really highlight the key role of how public health is really integrating mental health and physical activity, physical health activities together. Among other types of programs, nutrition, healthy eating, and physical activity were areas in which mental health activities or focus was embedded. So when we asked our participants to identify the use of the Ontario Public Health Standard or guidance documents to guide the specific activities that reported, the mental health activities reported, you can see here the red checks identify key program standards or guidance documents that, in the context of this webinar, show that mental health and healthy eating, physical activity, and healthy weights initiatives were really combined and aligned. So the Chronic Disease and Injury Prevention Program Standard, the Healthy Eating and Physical Activity Guidance Document, as well as the Nutritious Food Basket Guidance Document were all cited as key documents that guided public health unit activities related to mental health. So when we look at types of mental health and healthy weights activities, our review identified that there were several areas that promote healthy weights. So of the programs identified, most fit into certain types of activities, which you can see on this slide. So prenatal programs were often programs that addressed healthy eating and mental health. Playground and school-based programs, and we heard, there's in terms of Ophia's presentation, the link between mental health and healthy weights and physical activity is very prominent, and we can see from our results that playground and school-based programs really did have that interconnection between mental health and healthy weights. Communication campaigns to parents were also prominent, and then also a number of programs that focused on healthy body image and disordered eating prevention. Were really highlighted as in our review as those types of programs that really integrated a healthy weights approach for mental health. So the next couple of slides, I'm just going to highlight, and again, the report itself actually lists all the programs that were identified from our review. So that's 325 initiatives. Some of them are duplicates, but you can take a look at the full report, and there's examples of the programs with a short program description and link where available. So I'm just going to highlight a couple of examples of the types of activities and initiatives that were highlighted in our Connecting the Dots report, and pull out those ones that also had a healthy weights focus. So first we have PALS, and so this is called the Playground Activity Leaders in Schools. So this program started at Peel Public Health with 20 schools, and many school boards and health departments have adopted it. And since 2003, 20 schools were piloted, and the results have really proven impressive. And this program has so far been adopted by most Ontario school boards. So schools who have run the PALS program have observed a number of different things: increased physical activity in participating children, decreased playground conflict and bullying, increased leadership skills and self-esteem in students through skill development in leadership, communication, problem solving, organization, and cooperation. If you would like more information about the PALS program, Peel Region has some information on their website, and I can easily provide that link if you'd like. You can send me an email. I'll provide my email in the chat box after. So the next program that I wanted to highlight from our review of mental health activities that again, just to underscore, have a healthy weights focus is the Healthy Buddies initiative. And this initiative is from the BC Children's Hospital. So Healthy Buddies is described as a 21-week peer education program for elementary schools that focuses on healthy eating, physical activity, and positive self-image. And so in a recent evaluation out of the province of Manitoba, who did a pilot project on this, it shows improvements in self-esteem and healthy living knowledge. So again, it sounds like a great program. There's more information at www.healthybuddies.ca, and there's some information about the evaluation results on the Government of Manitoba website. And again, I can share that information should folks be interested in the evaluation of this program. And finally, the last program or initiative that I'd like to highlight from the Connecting the Dots survey is Girl Talk. So Girl Talk is a peer support group model which is based at the Hospital for Sick Kids in Toronto, and this program is called Everybody is Somebody. So outcome-based studies conducted on the Everybody is Somebody program, again, which is Girl Talk is adapted from, revealed very, very promising results, whether delivered in a classroom or a nurse-facilitated peer support group setting. Specifically, there were improvements were shown in global self-esteem, body image satisfaction, body esteem, and decreases in disordered eating amongst girls attending middle school. So again, there is information on the Sick Kids website about the Everybody is Somebody program, and if you would like that information, I can share that link, and I'll send my email. So those are just 3 examples of the 325 activities that were reported in the Connecting Dots. And after my presentation, Kayla Lee is going to be presenting on a program called Fuel, which is called Females Using Energy for Life, which was another example of a program that was highlighted in the Connecting the Dots survey, and I really look forward to Kayla's presentation. But before I turn it over to Kayla, I'd just like to highlight a great resource that will be released in fall 2014. It's actually expected for release in October. And so this is a partnership between Toronto Public Health, the Centre for Addiction Mental Health, and the Dowlana School of Public Health at the University of Toronto. And this is one of a series of online guides for promoting positive mental health across the lifespan. So we are revising the child and youth best practice guidelines for mental health promotion programs. Again, this is one of a series across the lifespan. We also have a guideline focused on older adults, refugees, and immigrants. Our CAMH website is currently going through a bit of an overhaul, but these will be all available online, and I believe they're also available on the HC Link website. So the guidelines series aims to provide guidelines that define best practice for mental health promotion initiatives and is based on a critical analysis of the literature. And each guide includes 11 best practice guidelines for mental health promotion initiatives for children and youth, including supporting theory, resources to help practitioners, including health promotion, public health, and child youth workers to plan and implement mental health promotion initiatives. It includes exemplary programs and references. So this is a really, really great tool to apply to existing physical activity, healthy eating, or healthy weights programs to insert and apply a mental health lens to make sure that we're taking a holistic approach to making sure we're focusing on both the physical and mental health of children and youth. So this, again, will be available in October. You can look forward to a webinar launch, which we'll be doing in collaboration with our Toronto Public Health and University of Toronto partners. More information will be posted on the HC Link website. And if you would like some more information or actually a hard copy of the resource, you can just send me an email. I'll just put it in the, I'll put it in the chat box now, but I'll just turn it over for comments and questions. And thank you, everyone.
Well, thanks, Kayla. We're going to hold the questions till the end. So after great presentation, very interesting. And I'd like to remind people that if they have any questions, they can type them into the chat box, and we'll get to them at the end of the webinar. And Kayla, you're up next. Would you like to tell us about the FUEL program?
Great. So I'm Kayla, and I'm the coordinator of the FUEL program at Niagara Region Public Health Unit. So FUEL stands for Females Using Energy for Life, and it's a school-based physical activity program for female youth. So I work in the Chronic Disease and Injury Prevention Division in the physical activity portfolio, and my whole focus is on youth. So I also coordinate the Sparking Life Niagara program, which is a program that focuses on the link between physical activity, academic performance, and mental health, in addition to FUEL. So this is an outline of what I'll be talking about. First, I'm going to discuss the background and why we chose to implement FUEL. So when looking at the physical inactivity crisis in Canada, the latest data from the Canadian Health Measures Survey shows that only 5% of children and youth are meeting the current physical activity recommendations of 60 minutes of moderate to vigorous physical activity per day. When broken down into gender, male versus females, we know that girls are less active than boys, with 9% of boys being active and only 4% of girls. The data also shows us that girls become less active as they grow, and this continues into adulthood. Physical inactivity is associated with many physical and psychological health risk factors, including heart disease, stroke, colon cancer, type 2 diabetes, low self-esteem, anxiety, and depression. So there are very few female-specific physical activity interventions that currently exist, and most interventions for youth tend to be co-ed, and they focus a great deal on sports or on competition. The research shows that many females do not enjoy competitive sports, especially at the high school age. So FUEL is an after-school, non-competitive physical activity program for female youth in secondary schools across the Niagara region. It's peer-led by an advisory committee within each school, each FUEL school. And activity sessions are led by volunteer certified fitness instructors, which allows the program to be offered for free. Typically, one fitness session per week is hosted by FUEL in the after-school period. So that's from about 3 to 4 o'clock in the afternoon. So in spring 2008, a walk-run program was implemented and evaluated called Run Like a Girl. At this time, we asked the girls what other forms of exercise they'd like to participate in, and we found that the girls wanted the opportunity to try a variety of new fitness sessions and activities, and they wanted to be able to try these activities in an inclusive, non-competitive environment that was female only. So in fall 2008, we did a call out to community partners to see who would be interested in working with us to develop a program, and this is when we formed a partnership with the YMCA of Niagara. In fall 2009, 1 year later, we implemented Fuel as a pilot program in 3 schools, and I'll share highlights from that evaluation in later slides. Currently, we have 17 schools participating in the Fuel program in Niagara, which is very exciting. So in the pilot year, 3 schools were chosen by public health based on the availability of nurses to help implement the program. However, in the years since, this is the process that we use when bringing fuel to new schools in Niagara. So this is the process that occurs now. So firstly, I recruit female fitness instructors, and I typically do this in the beginning of the summer, so from May to July, from the community and from the YMCA. So this allows me to understand how many fitness instructors I will have available and where they're available in our region. So we do have a number of municipalities in our region, and this allows me to see kind of where my gaps are and where I have saturation in terms of available instructors. So to recruit instructors, typically I use print ads, radio ads, and this year I did use Facebook ads in addition. And when somebody's interested, they fill out our online application to become a volunteer for Fuel. And then I arrange to meet with them, in which I discuss their interest and their background, and I also have them fill out some paperwork to become a Niagara Region Public Health volunteer. In June and July, the schools that are interested are able to complete our online application form. They learn about their program typically through their school nurse. Those schools who are already involved in Fuel need not apply, and they're automatically rolled in as a Fuel school for the following year. So they only need to apply once, and then after that, they're just automatically a Fuel school. Once schools have been selected, the teacher advisors and the school nurse from each of the selected schools are put through a 2-hour training led by myself as the coordinator, where I provide them with manuals and all the resources and information they need in order to start the program in their school. To form a Fuel Advisory Committee, teacher advisors recruit youth advisors in their school through an application process, or the teacher can select students that they feel would fit the role well. Once the committee is formed, they go through some orientation, which typically takes until the end of September, and this training is provided to them in the manuals that I give them. And things that they'll learn about is, how to promote the program, for example, amongst their peers. When the committee is established and their orientation is complete, the school will launch Fuel in a way that the committee decides. So this is up to the school how they want to launch the program. Something that happens typically is an all-girls assembly. So this is an assembly where they invite girls from grades 9 through 12, all the girls in the school, down to the gym. And they have an assembly where they talk about things like sexting. There's often a guest speaker. Sometimes we do an assembly-wide physical activity like Zumba. And they also watch clips from the film Misrepresentation, and we're able to offer them a photo shoot. So we do have a photo shoot kit where we have feather boas and sunglasses and hats, and we have signs that they're able to hold out that say things like, "I am courageous, I am strong, I am beautiful." And we do a photo shoot where we can take photos and we can print them and provide them with a copy of the photo. So it's a great way to kick off the program and to get interest going in the school. So just a note, in terms of recruiting the youth advisors, in some cases we found that it works better to actually get Fuel running and then to select the youth advisors from those girls that are actually coming out and participating. So these are the roles and responsibilities of the three key roles on the advisory committee. So the public health nurse provides support to the advisory committee in the planning and rolling out of the Fuel program in the school, and she's also able to provide health teaching when requested on topics such as sexual health, healthy eating, etc. The teacher advisors are the link between the youth advisors, the school administration, and public health. They motivate and encourage the youth advisors while providing feedback and input on the planning and promotion of the program. The teacher advisors are present at each of the fuel sessions, and they assist the youth advisors in booking locations and booking instructors for the program from the instructor list that I provide them. The youth advisors promote fuel physical activity sessions and events through announcements, posters, and in some cases through social media. They also are responsible for booking the instructors for the physical activity sessions and the locations for the sessions within the school. This does vary from school to school. It's the youth advisors booking the instructors in some schools, and in other schools it's the teacher that's booking the instructor. So it's really up to the school to organize things in a way that works best for them. The youth advisors are also responsible for creating a fuel message board and for updating it on a regular basis. In addition, they're encouraged to seek out and apply for grants to get money to use for the program. So for example, some schools did secure a grant from Loblaws to provide healthy snacks during the program. So that's something that we encourage the youth advisors to do, is to seek out those opportunities and to apply for them. They do have the opportunity to gain community hours for their involvement in the program as a youth advisor. So participation is increased through the use of a number of things, through the use of the all-girls assembly and photo shoots, as I mentioned before, through swag such as yoga mats when grant funding is available. We also provide a raffle at the end of the program, so for girls that are coming out and participating, there is a raffle for a free 3-month YMCA membership that's provided to us for free from the YMCA as our community partner. Healthy snacks also help to get the girls out. And the promotion through posters, Facebook, PA announcements, and most of all through word of mouth. So these are examples of some of the promotional materials we use. We have a weekly poster to promote the program session throughout the school that identifies what session's running this week. So for example, is it yoga, is it kickboxing, when the session's running, and where the session is running. And we also have health curriculum posters, and these are what we call stall talks, so we actually post them up in the bathroom stalls. And they promote fuel while also providing information on things like dating and relationships, sexual health, emotional well-being, physical activity, healthy eating and nutrition, and body image and self-esteem. These are also some other promotional materials. These are not typically materials that I would use in the school. These are more so for when I'm out in the community recruiting instructors to participate in the program as a volunteer. So we do have an upright banner, and we do use brochures as well. I also use a recruitment flyer. I don't have it up here, but I use a recruitment flyer to send to fitness centers to recruit fitness instructors each year. And this year I also modified that recruitment flyer to use as a Facebook ad. So what makes Fuel innovative and sustainable? So Fuel is peer-led by an advisory committee comprised of students, teachers, and public health nurses. It's not solely a public health run program, which is both innovative and lends to its sustainability. Fuel is an extracurricular program, and we need the volunteer teachers to help run the program. They play a huge role in the success of the program at each school, and when a school has a passionate teacher advisor that the girls look up to, it makes a huge difference in terms of participation. Partnership is also a large component of Fuel. The YMCA of Niagara provides volunteer instructors who go into the schools to lead workouts. The Niagara Catholic and our public school board are both involved and provide the space and the equipment for the sessions in the school. Niagara Region Public Health provides leadership and support. And public health has a physical presence in the schools through our school nurse, which really helps. Lastly, the use of local community fitness instructors who donate their time to lead at least 5 sessions per year is a component that really lends to the sustainability of the program. So in our pilot year, we did complete an extensive evaluation, which included focus groups of the participants and youth advisors and surveys to the teacher advisors and school nurses. Our full evaluation report can be found on our website, but I'm going to share some highlights. So in the pilot year, there was 131 participants in 3 schools, and overall the youth advisors felt engaged and enjoyed their leadership role. The youth advisors and participants enjoyed the variety of fun, non-competitive activities, and a common theme is that it was a great way to make new friends. And the girls also liked that they didn't have to commit to coming out every single week, that they could come to those sessions that they wanted to try. So in terms of our challenges, the key challenges are for location. So there's a lack of space in the school after school. There's other sports running at the same time. So it is challenging to find the space in the school. Teachers typically try to book the gym at the beginning of the year so they can kind of have a hold on it. But sometimes we do move equipment out of classrooms or actually run fuel in the hallway or other spaces that are available. In terms of communication, the schools found it was difficult to find a common meeting time for the Youth Advisory Committee, and it was difficult to communicate because of that. There's another challenge with equipment. So not all schools have the same equipment. So some schools don't have yoga mats, or they might not have steps, for example. So if they want to bring in a yoga instructor, but they don't have the mats, it becomes quite difficult. And also another challenge is participation. So there's fluctuating participation, and often participation in the program drops off after 6 to 8 weeks. So we're now recommending that the schools run the program for 8 weeks in the fall and then 8 weeks in the winter, as opposed to just trying to run it all year long, and it loses momentum. So some recommendations that we do have. We recommend no more than 5 youth advisors and 1 teacher advisor, just to keep things streamlined and to keep communication concise. We also recommend to book gym space well in advance and to occasionally offer fuel at different times to suit school needs. So for example, some schools it might work to run fuel before school, or in some schools it might work to run it over lunch hour. We also recommend that you offer mother-daughter evenings or events to encourage family participation, and we have done this. We did a Mother's Day event 2 years ago in partnership with the YMCA at the YMCA, where we invited girls from all of our fuel schools and their mothers to come out and participate in Zumba. So our key lessons are that promotion is key to success, and that grants and fundraising can enhance the program. You definitely need an enthusiastic, committed teacher advisor, and you need to provide teacher and advisor nurse training, but we don't recommend that you provide the training to the youth advisors as well. We did do that in our pilot. However, now I provide the training to the teachers and the nurses, and then we allow I provide them with the resources to actually train the youth, because then it's really a school-based project as opposed to public health coming in and doing all of the training with the youth. The school feels more ownership. And it's also important, obviously, to have administration and staff support. So fuel, in 2013 and 2014, we did not actively recruit new schools, as we're at our maximum capacity with the number of volunteer instructors we have that could offer the sessions. So we've been at 17 schools since 2013. I'm currently focusing on enhancing the programs that I have running in terms of resource development and further promotion within the schools. This summer I'm working on creating a toolkit of social media messages, both Facebook and tweets, that the schools can use, kind of like canned messages that are prepared. And in terms of evaluation, we're doing ongoing evaluation through surveys so that we can use continuous quality improvement to meet the needs of our participants and our schools. And instructor recruitment is an ongoing process each summer. We currently have over 50 certified instructor volunteers, and I'm now reaching out to Brock University and Niagara College fitness and health promotion students in hopes to bring them on as well. So I hope that you got a sense of the fuel program. You can check out our website for information on how to start fuel in your area and for a full evaluation report. If school-based physical activity for youth is of interest for you, I also encourage you to check out Sparking Life Niagara on our website. So that's a school-based physical activity program that integrates 20 minutes of aerobic activity and short 5 to 10 minute energy breaks right into the classroom in secondary schools. We have evaluated it, and it's shown improvements in academic performance and mental and emotional well-being of secondary school students. If you do have any questions about fuel or want to learn more about Spark, please contact me, and my contact information is up there. Thank you.
Thank you, Kayla. We do have a few questions in the chat box. We do have a few minutes, though, so if you'd like to put in a question, we still will have time to deal with it. There's a couple that are specifically for Kayla, so why don't we deal with those first. Pauline Gillen asked, are the volunteer instructors required to have police screening?
So yes, Pauline, the volunteer instructors do all have police screening. And the second question there, are the volunteer instructors only female? Yes, we only recruit volunteer instructors who are female, as it's a female-only environment.
Okay, thanks, Kayla. Then there's a general question to all the panelists from Michael Kerr. He asked, For each presenter, with any indicators that you use to track and measure health and related outcomes of children and youth, how do you capture and make visible hidden inequities and disparities buried in the aggregate numbers with respect to ethno-racial background, so First Peoples or people of color, gendered, LGBTQ-based, socioeconomic disabilities based on the basis of family status or citizenship or immigration status, etc.?
Lauren, perhaps I could take a step. Michael, I think one of the things that we promote here at CAMH organization within the Provincial System Support Program, but also CAMH, is even before we start looking at data that might have these hidden inequities, is ways to help mitigate, preventing this. So thinking about what kind of tools or resources we can use from even before we start piloting programs. So for example, CAMH really advocates the use of the HIA, which is the Health Equity Impact Assessment, which can help mitigate unintended consequences of programs to make sure that they're not unintentionally alienating or disenfranchising some of the populations that you've outlined below. The other thing that I think we really try to advocate in, and we heard that in terms of OFIA, is really making sure that meaningful engagement of participants from the very onset of projects is there. So in the case of looking at children and youth, making sure there are opportunities for youth to have an active but meaningful opportunity to contribute to the development and objectives of a program will hopefully help prevent some of these inequities that you're speaking to. I realize that might not directly respond to your question, but hopefully will provide a little bit of context in terms of what we're trying to advocate.
Thanks, Tamer. Kayla, do you have anything to say about that? I think Kayla's muted. Why don't we ask Drew or Margaret? Do you have any comment on that question?
Hi, can you hear us?
Yep.
Yeah, I think we kind of echo some of the similar things to what Tamar was saying. Like, I think the one piece around just within the consultation process, making sure that you do have that sense of who's around the table and who's in that community as well. So a lot of the qualitative data that we've collected, specifically I'll speak to kind of the Smoke Free Ontario piece around kind of student focus groups and documenting conversations at school team meetings. A lot of that really relates to understanding to the context of the school. So we have had some schools, working with some in Thunder Bay, where we did have some students who are First Nations who gave us a context in terms of what tobacco use means to a First Nations community, and understanding that we were sensitive to that before developing our action plan, or even how the project is framed in general as well. Part of it as well is leveraging what's already in place in the school as well. So in some instances you might have gay-straight alliances that operate within the school, making sure we're aware of that and understanding that that might be a piece that we should be considering in the types of activities we're planning or who we're engaging. And one of the key learnings too was around these school action teams. Really encouraging the members of the school and the youth themselves to reach out to students who might not typically be those typical school leaders. So understanding, if you're doing a tobacco project, understand the people who might be most impacted by that and how you can get them around the table versus the people who maybe aren't at risk or aren't impacted by that specific topic area as well. So that's kind of the process we take to make sure we try to mitigate some of those things. But from an evaluation perspective, a lot of it is coming out in kind of the qualitative data that we have, and that would just be considered integrated. And some of the schools as well, depending on the board in the area, have indicators in place in terms of identifying certain schools as high risk in certain areas or with a certain population as well. So we try and take that into consideration too.
Okay, thanks very much. That's the end of the questions. So I guess we'll wrap. Thank you to all the presenters. You did a fabulous job. And I'd also like to thank all of the participants. It was great to have your participation on the webinar. If after today's webinar you're interested in receiving HC Link services, you can visit our website to request a consultation. On the website there's that red button, Service Request, and you just click on that and that takes you right to our service request form. Our team can work with you in a variety of ways. We can help plan and evaluate your programs, build and expand your networks, and develop policies. We look forward to working with you in the future. Thank you very much. Oh, and there will be, as we close the webinar, a short questionnaire will appear on your screen. I hope you'll answer the questions, and we'd love to hear your comments as well. You'll also receive a questionnaire by email, so you can complete it later if you prefer. So thanks, everyone.